Let's talk about the Mental Health Perspective series with the second IACP Vice President, Louis Dekmar. Chief Dekmar, welcome. One of the topics quite widely talked about at the conference this week is mental illness and how officers deal with that. So how big an issue is that for police officers at the moment?
It's a significant issue for police agencies, law enforcement agencies. We've seen for the last 40 to 50 years an increase in the number of individuals that suffer from mental illness that have been brought to the attention by the police for a variety of reasons that the police don't control, but nevertheless are responsible for responding to those calls. And unfortunately, as those numbers increase, those encounters that result in the use of force and deadly force also increase. So once law enforcement recognized that those kind of calls were increasing and the nature of those calls were playing out in a way that involved the use of force, IACP gathered together a blue ribbon panel, and based on the findings of that panel have initiated a campaign that will be rolling out later at this conference.
Tell us a little bit, Mental Health Perspective series and the One Mind campaign. Tell us a little bit about them.
Yeah, the mental health series, what it's going to do is kind of give background and a backdrop to the reason for the One Mind campaign. It's going to share with those participants that attend how we got into the situation that we presently are, how to identify those mental health resources in their communities that they can use as a way to deal effectively with those involved with mental illness.
What are the goals of the Mental Health Perspective series?
The goal is inform, give the individuals that attend an appreciation for the significance and seriousness of the challenges dealing with individuals affected by mental illness, and then help them to understand what tools are available to deal with those challenging events, and then of course to roll out the One Mind campaign.
Final question, almost to go back to the beginning really, and the officers who are dealing with these incidents. What can be done to better train officers to work with other agencies, and of course other agencies to work with the officers?
Well, and that's the interesting component of the One Mind campaign, because we involve the resources and disciplines that treat mental illness. They've agreed to partner with us on this campaign, and they're going to be advising their members to seek out law enforcement. We're going to be encouraging our members to seek out those individuals that provide treatment and resources to those affected by mental illness. And as a result of that joint partnership, do a couple of things. One is create an easier availability for the treatment of those individuals affected by mental illness in those community-based programs, and also reduce the significant likelihood of a use of force encounter with someone that's affected by mental illness. And so oftentimes the police are called into situations that they can't control but are compelled to react to because of the public safety situation that's been created. So that's the goal, both from the multiple disciplines on the provider side and also on the law enforcement side.
Well, Chief Dekmar, thank you ever so much indeed for that. We appreciate your time.
Well, thank you. And we look forward to you joining us when we roll out that campaign.
Absolutely. Thank you.